Hello, this is part 16F on early effects of radiation on humans. So let's begin with the acute radiation syndrome. This is a sequence of events after high level radiation exposure that leads to death within days or weeks. It's also known as radiation sickness. The dose response relationship for the acute radiation syndrome is a nonlinear threshold. Now, the stages of the acute radiation syndrome include the prodromal period, which is where there's going to be immediate response of radiation sickness. The clinical symptoms occur within minutes to hours, and this is when a person has a dose of greater than 1 gray. It extends from a few hours to a couple of days, and the clinical signs and symptoms are nausea, vomiting, diarrhea, and leukopenia. The latent period is the second stage, and this is a stage during which there's no sign of radiation sickness. In fact, the patient feels pretty good. The dose is between 1 and 100 gray and extends from hours to weeks, and there are no signs or symptoms, like I said before. Manifest illness is the period during which the symptoms become visible. It's the true effects of the exposure that are seen, and it's the clinical signs and symptoms of acute radiation lethality. There are three syndromes, and that is the hematologic or hemopoietic, the gastrointestinal, and the CNS syndrome. Recovery or death is the final stage. The primary effect of acute radiation syndrome is lifespan shortening, but recovery or death can occur during the hematologic syndrome, where there's only death is possible with the GI and the CNS syndromes. During the hematologic syndrome, the dose is 2 to 10 gray that a person would have to receive to go through this syndrome. During the prodromal period, the symptoms are pretty mild for the prodromal, and that's the nausea, vomiting, and diarrhea, the fatigue, the leukopenia, that occurs in a matter of a few hours and may persist for several days. The latent period is going to be 4 weeks in length, and there's going to be the number of cells in the peripheral blood will decline during that period. However, the person will feel good. During the manifest illness, there will be a decrease in the white blood cells, red blood cells, and platelets. There'll be vomiting. The person will have mild diarrhea, malaise, lethargy, and fever. If the dose is not lethal, recovery can begin in 2 to 4 weeks, but it may take as long as up to 6 months for full recovery. If there is death that occurs, it's because of generalized infection, electrolyte imbalance, and dehydration. The mean survival time, should the person die, is 10 to 60 days. For the GI syndrome, the dose to cause it is 10 to 50 gray. With this one, the prodromal period begins with vomiting and diarrhea that occurs within a few hours of the exposure and can persist for hours to as long as a day. The latent period is 3 to 5 days, during which the person will feel good. The manifest illness, the person will have damage to the hematologic syndrome system but it will be more severe than what it was with the hematologic syndrome. They'll have a second wave of diarrhea, they'll be anorexic, they may become lethargic, and diarrhea will lead to loose and then watery, bloody stools. No recovery is possible. Death will occur primarily because of severe damage to the intestinal crypt cells. The mean survival time will take 4 to 10 days. For the CNS syndrome, the dose is going to be above 50 gray to cause this to occur. There's severe nausea and vomiting, usually within a few minutes of the exposure, may become extremely nervous and confused, complain of a burning sensation of the skin, and lose vision and consciousness within the first hour. The latent period is up to 12 hours, and symptoms may subside or disappear. For the manifest illness stage, the symptoms occur suddenly and with extreme severity. The person becomes disoriented, loses muscle coordination, has dyspnea, may go into convulsive seizures, experiences loss of equilibrium, ataxia, lethargy, and goes into a coma. And there's severe damage to all other organ systems. The outcome of this particular syndrome has always been death within 3 days of the exposure, and no recovery is possible. The cause of death is elevated fluid content of the brain, which is hydrocephalus, and the mean survival time, as we already said, is 0 to 3 days. So with the acute radiation syndrome, the mean survival time is the average time between exposure and death. And time is dose dependent. As dose increases, the average time between exposure and death decreases. LD5060 is a measure of acute lethality. It's a whole body radiation dose that causes 50% of irradiated subjects to die within 60 days. And the LD5060 is 3.5 gray in humans. It follows a non-threshold dose-response relationship. Local somatic effects are talking about when there's only part of the body that's irradiated, and it's going to take a higher dose required to produce a response. The effect is cell death, which results in atrophy or recovery, but the idea is that the local tissue response depends upon intrinsic radiosensitivity and also kinetics of cell proliferation and maturation. Local tissue that can be affected immediately are the skin, the gonads, and the bone marrow. The dose-response relationship is nonlinear threshold, and the minimum dose is necessary to produce a deterministic effect. When the threshold dose is exceeded, severity of response increases with increasing dose in a random fashion. So some somatic effects we're talking about here with the skin. So the most radiosensitive layer of the skin is the basal cell layer. SED50 stands for skin erythema dose to 50% of the population. So its dose required to affect 50% of the population irradiated with superficial X-rays and cause erythema. SED50 is about 5 gray. So some early somatic effects that specifically from high dose fluoroscopy include early transient erythema, and that's 2 gray, and what happens within hours of the time frame that it started. Main erythema, which is more intense redness, is at 6 gray. Temporary epilation will begin at 3 gray, and it takes 3 weeks from the time of onset. Permanent epilation requires 7 gray, and moist desquamation requires 15 gray. Hematologic effects include are composed of bone marrow, circulating blood, lymphoid tissue, which includes your lymph nodes, your spleen, the thymus, and the principal radiation response is a decrease in the number of blood cells in the peripheral circulation. In adults, the active bone marrow is responsible for producing circulating cells is reduced to flat bones, such as the ribs, the sternum, and the skull, and the end of long bones. The minimum whole body dose necessary to produce a measurable hematologic depression is 250 milligray, and the first cells affected are lymphocytes. Lymphopenia occurs within minutes or hours following exposure, and they're slow to recover. The threshold doses for various somatic effects include 2 to 10 gray will result in hematologic syndrome if exposed to the whole body. 10 to 50 gray will result in the GI syndrome if exposed to the whole body. Greater than 50 gray will result in the CNS syndrome exposed to the whole body. 3.5 gray to the whole body will result in LD5060 for humans. 5 gray to small field will result in SED50. 250 milligray to the whole body will result in hematologic depression. 2 gray small field will result in erythema. 3 gray small field will result in epilation. 2 gray to the whole body will result in death. 100 milligray to the small field will result in a decrease in menstruation or decrease in sperm count. 2 gray small field will result in temporary infertility. And 5 gray to small field will result in permanent sterility. Now, cytogenetic effects are the study of the genetics of cells, particularly cell chromosomes. There's early effects, that's when the body is irradiated, all cells can sustain cytogenetic damage. When the cell survives, damage is manifested during the next mitosis after the radiation exposure. Late effects can be that although chromosome damage is produced at the time of irradiation, it can be months or even years before the damage is measured. Chromosome hits are interactions with chromosomes that can be via the direct or the indirect effect. These interactions result in a hit, and the chromosome hit represents severe damage to the DNA, and this results in a visible derangement of the chromosome. Single hit chromosome aberrations involve chromosome deletion, which is otherwise called terminal deletion. And that's where you get little fragments of a chromosome called isochromatids that do not have a centromere. The dose response relationship is linear, non threshold. Multi hit effects are looking at how the chromatids are joined depends upon the quality of the stickiness that appears at the site of the severed chromosome. There can be ring chromosomes or dicentric chromosomes that we'll take a look on the next slide. Additionally, you can have reciprocal translocations in which there's no loss of genetic material, but it does rearrange the genes and it's organized in an incorrect sequence. The dose-response relationship for multi-hit effects it's a non-linear, non-threshold. So in the top left-hand side is showing the ring formation and the dicentric formation, and the bottom right showing the reciprocal translocations where we're rearranging the genes. And this is just showing the multi-hit and single-hit chromosome aberrations. And this concludes our video lesson on early effects of radiation.